Some of the more important items to remember here are the letters assigned to Medicare and Medigap plans. Remember, Medicare Part A is hospital. Part B is medical. Part C are Medicare Advantage plans. And Part D is a prescription drug plan. Medicare supplement plans have their own letters and have been standardized by CMS into 10 contracts, designated by letters A through N. Don't forget the core package and its core benefits must be included in all plans. Medicare Advantage or Part C plans are also issued by private insurers that work with Medicare and typically provide benefits that Medigap and Medicare do not. Benefits such as prescription drug coverage, vision, dental, a host of others may be available, depending on the plan and where a person lives. As we move to Part 2 of the policies, we're going to explore group insurance. There are significant differences between individual and group insurance coverage, and you'll notice that group has a tendency to provide better overall coverage compared to individual policies. Be sure to understand the differences in terminology between individual and group coverage. For example, the sponsor of the group plan is responsible for adherence to the rules that are part of the plan. But in an individual plan, the individual is responsible for staying within the rules. There are many different types of sponsors: employers, affinity groups, lenders, travel agencies, sports clubs, schools, and many more. Remember though, a group can't be formed just to buy group insurance. It must be formed for some other unrelated purpose. Something that bears mentioning is that if a person is covered by more than one group policy, the insured can't collect fully from all of the policies. Insurers apply what are known as coordination of benefits provisions to synchronize coverage between them, to cover the loss in such a way that the insured doesn't profit from it. Group underwriting criteria are explored, and you'll notice some big differences here. Individual insureds are not individually underwritten. Instead, the insurer considers a group as a whole and considers a group's overall exposure to risk. We'll be exploring the fundamentals of group underwriting, the processes involved, and the factors carriers need to consider. There are many different types of group legal structures and provisions that affect these types of contracts, and we include material on the different ways a group may be formed to buy coverage. Group policies have what are known as open enrollment periods. If an individual joins a benefit group during this time, no medical questions may be asked, and coverage is guaranteed. On the other hand, if a person doesn't join during an open enrollment period, there are good chances that they won't be approved for coverage at that time if there are any current medical issues. Proof of health will normally be required during a closed enrollment period. Expanded information on pre-existing conditions and how the Patient Protection and Affordable Care Act commonly prevents the use of exclusions is explained. We'll also look at the Health Insurance Portability and Accountability Act, or HIPAA, and how both of these legislative acts strengthen patient protections and change the health insurance landscape dramatically. Important aspects of group insurance, such as the factors that insurers use to determine rates, eligibility for group coverage, and regulatory issues will be considered. We'll also take a look at how benefits may coordinate when an insured has more than one health insurance policy. We finish this section with a look at small employer health plans, the rules associated with smaller employers that wish to obtain group coverage for their employees, and how a small employer may obtain group coverage through the federal SHOP marketplace. Group policies and group underwriting are very different from individual policies because an underwriter has much less information about the individual insured. Instead, the underwriter has to rely on the characteristics of the group and other criteria to determine an initial assessment of the risk and develop an initial premium rate based on that. Carriers are able to bypass the element of individual assessment with group policies because these policies can be re-evaluated on an annual basis and adjustments can be made to the rates charged. Let's get started.